Hey again, everyone. Good afternoon. Thank you so much for joining us. My name is Rebecca Sterling. I'm the Assistant Deputy Director for the Office of Strategic Partnerships here at the Department of Healthcare Services. Thank you again for joining us and taking time to be a part of this important conversation about BrightLife Kids and Soluna, two programs that are available across the state of California. As you likely know, today's webinar is focused on what early, accessible behavioral health support can mean and can offer to children, youth, young adults, and families. And what we now know, having made these programs and services available to Californians for over 2 years. Before we get into the webinar and the exciting data and impact we're looking forward to sharing, I did want to do a little bit of housekeeping. We do have the Q&A feature available during the webinar. Please feel free to enter any questions into the chat as you have specifically into the Q&A feature, and we'll do our best to get back to you as quickly as we can. We'll also be sharing contact information for any follow-up that we don't get to at the end of the webinar. When you submit a question, it is helpful if you give a little bit of context if it's specifically a question about BrightLife Kids, Soluna, or if it's more relevant to a specific theme around coaching or referrals. You can go ahead to the next slide. This is actually what I just kind of touched on a little bit, but we will be sharing a little bit about BrightLife Kids and Soluna as programs and an overview. We'll be going into some highlights from the recent 2025 impact report that we shared. We'll then have a moderated panel discussion to go a bit deeper into both programs and really what these digital virtual behavioral health services are doing and offering. And then we'll close out the webinar with some closing remarks and making sure that you all have contact information for where to go to learn more and to stay engaged and involved with BrightLife Kids and Soluna. Next slide. The Children and Youth Behavioral Health Initiative, or CYBHI, as you'll hear it referred to during today's webinar, is fundamentally transforming how California supports children and youth and families by building a coordinated system of care across multiple different settings. The CYBHI is meeting children, youth, and families in the places where they are, in the ways that they are asking for care. And that means in healthcare settings, in schools and colleges, in homes and communities, and very much includes in digital spaces, as you'll hear about today. BrightLife Kids and Soluna are essential pieces of that vision, helping us bring behavioral health support online and expanding access for families who have historically faced long wait times, geographic barriers, and stigma for various different reasons. You could go ahead to the next slide. These platforms are meant to be complementary and expand existing resources and services. As I noted, they are meeting youth and families where they are, online, as we live in a hybrid world, in homes and communities, and in really wherever is convenient to them. BrightLife Kids and Soluna are expanding prevention and early intervention supports across the state, and adding accessible digital tools for families. Next slide, please. You'll hear much more about BrightLife Kids and Soluna and the services within both platforms, but I wanted to make sure you all had a bit of a high-level understanding of these programs and services. BrightLife Kids is designed for parents and caregivers of children ages 0 to 12, offering one-on-one coaching in more than 17 languages, peer support, and referrals when higher level of care is needed. Soluna is designed for youth and young adults ages 13 to 25, providing flexible video and chat-based coaching, pre-moderated safe community forums, self-guided tools, and care navigation to higher levels of care and community-based resources. All of the services through BrightLife Kids and Soluna are available for free at no cost, regardless of insurance, immigration status, and with no referral needed. Together, these platforms are offering prevention and early intervention free of cost to all California children, youth, and families statewide. And now we'd love to share a bit more about these programs and the impact they are having. I'm happy to introduce the Deputy Director of the Office of Strategic Partnerships here at DHCS, Autumn Boylan, who will share these highlights.
Much, Rebecca. I'm so glad to have you all here with us today to talk about our impact report and the work that we're doing to support children, youth, and families in California through BrightLife Kids and Soluna. I'll say at the beginning of Mental Health Awareness Month, it's extremely impactful, I think, to hear the stories of our young people in these impact reports, and to know that we are able to make a difference in the lives of so many children, youth, and families in California with this work that we're doing. The impact report is available on our DHCS website. You can link to it as well as our CalHope page, and we're going to drop that in for folks to have a copy of it so that you can look at it as you're walking through. But before we kind of go into all of the details, and there's so many great things highlighted in this impact report, I do want to share a brief video that's a part of the impact report that I think does a really nice job of kind of telling the story of BrightLife Kids and Soluna, and gives you a chance to hear directly from some of our youth users and some of our parents. From the report.
California's mission is to make mental health and substance use disorder services more equitable and accessible for its children, youth, and families. As part of the Children and Youth Behavioral Health Initiative, or CYBHI, BrightLife Kids and Soluna have provided thousands of families with free behavioral health services and supports, offering confidential one-on-one coaching and on-demand tools across the entire state of California.
Having something in your pocket that you can access privately can change a life trajectory for a young person.
For children ages 0 to 12 and their parents and caregivers, BrightLife Kids addresses a variety of common behavioral issues in early childhood that can lead to behavioral health concerns if unaddressed. And in 2025, BrightLife Kids didn't just expand its reach to more children than ever before. It improved behavioral health outcomes for children and families.
Me and my daughter's relationship has turned a lot softer and a lot more open.
It also reduced parent and caregiver isolation, stress, and worry, and improved family relationships.
It's an opportunity for a whole family, not just for my son.
For teens and young adults ages 13 to 25, Soluna offers free behavioral health support when, where, and how young people need it, helping teens and young adults feel seen and understood.
I love that it's not only about speaking with a professional, it's about what works best for you.
In 2025, independent researchers at Northwestern University conducted a study that found Soluna decreased user distress after just 1 month.
Distress stayed at the low end of moderate from the 1 month to 3 month follow-up. Youth were reporting benefits in Soluna that were sticking with them over time.
Thousands of local community and statewide organizations across California, including school districts and healthcare providers, are partnering with BrightLife Kids and Soluna, identifying complex needs and connecting children, youth, and families with local resources.
BrightLife Kids has made a huge positive impact on the community that we serve here. It's so flexible and it's super useful.
When something exists that is free, confidential, and accessible immediately, that is powerful.
California is not just providing free evidence-based behavioral health support. We're meeting children, youth, and families where they are to help all Californians thrive.
It's just really giving me the tools on how to be a better, more present mom.
It's definitely important for youth to build their skills to manage their mental health.
It's a fabulous service, and I can't believe that it's free.
Given that the national burden that mental health creates for people of all ages, these tools are pretty indispensable.
Learn more about our impact at calhope.org/impact.
I think that the stories and hearing directly from our youth, directly from parents and caregivers, from our community partners, makes such a difference in the work that we do every day, both at DHCS and I'm sure for all of you. And I really love kind of these stories that are coming to life as people are giving their testimonials about using BrightLife Kids and how much that service has helped families, parents and caregivers really kind of being able to work through common childhood issues that all of us face. I know when my kids were little, just the whole notion of like feeling alone and like you're doing everything wrong. Really, Bright Life Kids gives an opportunity for parents and caregivers to come together in community with each other and feel that they're not alone and that they have the support they need to support their children and youth with emerging behavioral health needs, developmental needs, sleep, hygiene, all of those things, or peer relationships, bullying, especially as kids get into school, all of those things that young people, are facing in their daily lives. And then with Soluna, the opportunity for teens and young adults to have some agency around seeking support for when they have a behavioral health need, when they need somebody to talk to about their own big feelings, their challenges, as young adults are learning how to adult, which we all know is a difficult thing to learn how to do, that these services really provide a lifeline for our children, youth, and families. Rebecca already talked about, what Bright Life Kids and Soluna offer in our communities across California. Do want to make sure that we're noting that both of these programs are available in English and Spanish. Both offer telephonic coaching services in 17 additional Medi-Cal threshold languages across the state. We really are trying to make these programs accessible for all children, youth, and families in California. And the impact is really staggering. In just 2 years, we've reached more than 500,000 children and youth and young adults through Bright Life Kids and Soluna. And that rate of utilization is growing rapidly. Even just since May of 2025, when we issued our prior impact report, we've seen a 57% growth in utilization of these programs. These programs have also delivered over 112,000 telehealth coaching appointments, whether that's via video, as a more traditional telehealth appointment might be, or through chat-based appointments. Folks are able to reach out when they need the support, and really more timely than we might expect in reaching out to our health plans, our providers, or community-based organizations. Bright Life Kids offers appointments with an average appointment date of 1.4 days from the day of request, and Soluna has been able to offer on-demand appointments on a drop-in basis 7 days a week from 10 a.m. to 10 p.m., as well as appointments with the user's coach of choice within 3 days. And again, these are just really amazing access points for children, youth, and families in California. And that's an 81% in coaching from our last report in May of 2025. All 58 counties in California have families, young people who are using these programs to obtain support for mental health and substance use disorder needs. And what we know to be true is that of the people who are using the coaching services, that are using these platforms to obtain support, 98% of users are satisfied with their experience, which means what we are seeing being delivered is of high quality, and folks are really getting what they need out of these programs. We do know that app-based and web-based supports, even telehealth programs, are not always enough to meet the needs of every child and youth in California. And so as part of the overall design of Bright Life Kids and Soluna, we built in a structured care navigation program where both Bright Life Kids and Soluna teams have direct relationships with community-based organizations where they can make a referral for individuals who need higher acuity services, whether that's clinical support or crisis services, or to get connected to social services in their community. And these numbers are really impressive. In our impact report, and I'm not going to go through all of these, but one of the things that you'll see is that there are many, many community partners across California who are working with BrightLife Kids and Soluna to really help augment and supplement the work that they are doing locally to support children, youth, and families. So this isn't about BrightLife Kids and Soluna replacing in-person community-based care and supports or school-based supports, or even more clinical supports that are offered through our managed care delivery systems in California. The role that BrightLife Kids and Soluna can play is really invaluable, I think, to community partners, and you'll see that reflected in some of these testimonials, where these services can really provide that supplemental support, that front door support when people don't know where to turn. And lots of kids across California, thousands of kids that we interviewed before we launched BrightLife Kids in Soluna, parents and caregivers too, told us they didn't necessarily know where to go when they needed support for mental health services. Now there's a place for folks to go, and that these programs can serve as that front door. So they really play an important role in complementing the overall behavioral health delivery system in California. And these testimonials that you see kind of scrolling through in the impact report will give you a good sense of what our partners think about these programs. Just going through a little bit of updates for BrightLife Kids. 93% of parents and caregivers reported improvements in their child's behavioral health after using BrightLife Kids, along with a stronger ability to manage their child's needs. We also saw that 83% reported that using BrightLife Kids in their family reduced stress for the parents and caregivers. They were able to improve in areas of caregiver strain based on the caregiver strain questionnaire, including family disruption, sadness, worry, and fatigue. I know as a parent, when my kids were growing up, I always had concerns about their health and well-being. And I know all of you who have kids feel the same. And these tools offer a lifeline for parents and caregivers to be able to reduce some of those worries and those stresses by building in a framework of skills, knowledge, abilities that help them manage health and well-being within their family. And BrightLife Kids is meaningfully improving behavioral health outcomes for kids and families. 92% of children using BrightLife Kids showed improvement in their personalized behavioral health coaching goals. 89% of families saw improvement in emotional or behavioral challenges. 95% of parents and caregivers reported improved ability to manage their child's needs. Now, talking about Soluna, we're seeing also, as you saw in the video, incredible results for Soluna as well to really help support our teens and young adults in California. The partnership with Northwestern University is an incredible start to evaluating the effectiveness and clinical outcomes for Soluna, but it's really impressive to see statistically significant reductions in overall distress. We know that even well before the pandemic, young Californians were experiencing very high levels of emotional distress and suicidality, and that we are starting to see some improvement in the overall, well-being of California youth, as noted through the California Healthy Kids Survey and other kind of statewide measures of well-being for children and youth. But to know that Soluna offers a solution that has statistically significant clinical outcomes to help improve health and well-being for our young people is pretty incredible. And across the board, we're seeing young people who are using Soluna really showing those significant reductions. We're reducing stress and distress consistently for all Soluna users, regardless of background or identity. And those effects are lasting 3 months post use of Soluna. You'll also see some of our users in our impact report, and really hearing directly from users of these programs is the most important part of the work that we do. But you'll see some testimonials as well as the videos that are a part of the impact report. And just like with BrightLife Kids, we're seeing pretty incredible results from the work, with 97% of coaching users reporting feeling heard, understood, and respected, and 98% of coaching users rating their sessions with positive feedback. 95% of teens and young adults that you've used Soluna have said that they would recommend it to a friend, which I think is one of the greatest markers of how useful this tool is for our teens and young adults. If they will tell their friends about it, that's how we grow our impact, because that word of mouth, particularly for teens and young adults, is so critically important. So there's a lot more that you can go through in our impact report, a lot more about our community partnerships and where we're going with these programs. But I will turn it back over to Rebecca so that we can start to hear from some of our partners and colleagues in this work. Thank you all for being here today.
Thank you so much, Autumn. Really appreciate all of those highlights that you were able to share. Now it's my honor to introduce our panel conversation for this afternoon. Without further ado, I'll go ahead and introduce our moderator for the panel, who often needs no introduction. Darrell Steinberg is the former Sacramento mayor, Speaker Pro Tem Emeritus of the California State Senate, and notably, especially for our conversation today, as the author of the Mental Health Services Act and a leader in behavioral health services. For the panel discussion, Darrell will be joined by Tisha Montero, who is a branch chief at the Department of Healthcare Services and leads cross-sector initiatives that strengthen California's behavioral health systems of care. From representing BrightLife Kids, we'll have Noah Oldak Moradian, who is the Senior Director of Community Engagement at Brightline, where she leads partnerships, field outreach, grassroots initiatives, and expands access to BrightLife Kids. Dr. Shannon Tyne is the co-principal investigator for the UCLA UCSF ACEs Aware Family Resilience Network, UCAN. She is a professor of clinical pediatrics at the David Geffen School of Medicine at UCLA, chief of pediatrics at Los Angeles General Hospital Center, and director of pediatrics for the Los Angeles County Department of Health Services. And with us representing Soluna, we have Dr. Tully, who is a clinical psychologist and VP of Partnerships and Clinical Integrations. Tully is widely recognized for their expertise in clinical governance, digital therapeutics, and population health strategies. We also have Duke De La Rosa, who is a second-year history and political science double major with a minor in public policy at UC Berkeley. Duke is keeping very busy. Duke founded Soluna's first college chapter network and, inspired by his lived experience, is an advocate for youth and access to free, confidential mental health resources. So I'll go ahead and turn it over to you, Darrell. Thank you all so much.
Oh, Darrell, you're muted.
Go. Okay, good. Now I've figured out the technology. Great to be with all of you. Thank you so much for the excellent, thorough presentation of the impact report. And now we have an opportunity to, as Sterling said a moment ago, to really get into some detail about all of this. And I'd like to start with the panel talking about the definition in the way these programs are implemented of coaching itself, because, you know, sort of the stereotypical, at least historic way people have thought about mental health treatment for kids, it is therapy and medication, or traditional therapy and medication, and coaching and triage, if you will, is a very, very different way to approach this, especially given some of our workforce shortages. But let's talk a little bit about what is coaching and how does it lead to the outcomes that we heard about a moment ago. Who wants to start? Dr. Tyne?
I'm hoping you can all hear me. It's nice to see you all. I'm a practicing pediatrician, and I've had the benefit of engaging with coaches in other settings. So in addition to the engagement with BrightLife Kids and Soluna, I see coaching in two ways. I see as a pediatrician working with parents and their children, it's as a parental empowerment. It provides an opportunity for families to learn how to engage with their children in ways that I'll address in some of the later topics that we're going to discuss, but a great way to help elevate parents and youth to understand that they're doing a great job and they may just not know it. And framing it in that way with a coach, just like I would have a professional coach or you would have a baseball coach, it's somebody that helps build someone up. But the other thing that I see the coaches at in the universe that I'm working in, particularly with BrightLife Kids, which I have more experience with, is in serving as a bridge to helping people get to things that they need, whether it be transportation to an appointment or access to that school individualized education plan that you've been trying to get for years, but you just didn't quite know how to do it, breaking down a language barrier, or helping with those little things that aren't little when you're living them as a parent or a youth. And I think those are my two framings. And I know we don't have a whole lot of time, but for me, coaching is an essential component of healthcare, whether it be medical or mental health. And I think we haven't paid enough attention to it in the work that we've done until now. And so I'm really thrilled that this overlay is starting to help take the spokes of the wheel and get them all connected so the wheel rolls a little bit better.
Well, thank you, Doctor. So Tully and Noah, I'd like you to maybe expand on Dr. Tynes' answer and talk a little bit about what are the qualifications to be trained as a coach? Who are the people that are providing this coaching?
Yeah, absolutely. So at BrightLife Kids, our coaches have a master's degree in a health-related field or a bachelor's degree in combination with a coaching certification. So we work with the International Coaching Federation and the National Board for Health and Wellness Coaching. And they're also expected to have a minimum of 5 years of direct experience working directly with families. Of course, they're overachievers and averaging between 7 and 8 right now. And then they also undergo an additional 80 hours of in-house training. And part of that training includes how to work with diverse populations. So there's a lot that goes into making sure that the folks who are working directly with families are qualified to do so. And if you'll allow me, I just want to expand on Dr. Tynes' great sort of definition of BrightLife Kids, of coaching. At BrightLife Kids, it's really family centric, right? So when we talk about the personalized goals that we are setting with families, we are working on the strategies to obtain those goals and making sure that it's the parent and caregiver and the child that have a shared language to obtain those goals. So just to provide an example and really bring it home, when I was pursuing coaching as a parent, my child was really defiant. We were having some really intense behaviors at home. And so we were working on what are the interventions that I can practice today, right, to deal with those behaviors. So again, we want to make sure that we're applying an early intervention prevention model so that we're dealing with issues before they become more highly acute.
Thank you. Dr. Tully?
Yes, thank you so much, and good afternoon, everyone. At Soluna, we also require the same standards for our coaches as Noah described. But I want to add on a little bit to what coaching actually looks like on Soluna. We serve a slightly different age range, a slightly different service user. So there's 4 things I think is really important to know about our coaching. First of all, it's very solution focused with a very goal oriented model. So it's designed to deliver meaningful support in a single session. So it's a one at a time approach. So it's built for immediate impact to help the young person identify the strategies that they can use in that moment that are aligned with their goals and their values. It also has a very broad scope of support compared to traditional therapy. So coaching can cover any number of life topics like school and jobs and relationships and family concerns and stress, as well as mental health challenges like anxiety and depression. But it's not contained to just mental health. And the third thing to know about coaching and how it's different from traditional therapy is that it's delivered by a really diverse, trained and certified workforce. So at Soluna, this includes certified peer support specialists who have gone through state certification process to learn how do you weave your lived experience of mental health recovery and other social challenges into mental health coaching, as well as certified wellness coaches, certified substance use disorder counselors, and other behavioral health professionals. So not just therapists. So you get this really diverse workforce, which can really address a variety of needs from a young person. And then finally, there's a real flexible engagement model in coaching. Youth can drop in as they need, they can schedule one-off sessions, they can engage in a series of sessions with their coach. They can meet with one coach on day one and a different coach on day three, or they can create a relationship with a particular coach that they like. So really flexible in terms of engagement, flexible in terms of the type of trained professional you're engaging with, flexible in terms of the support that you're getting, the issues you're getting support for, and focused on helping you find the solution. So yeah, that's how I would define coaching, and that's what it looks like on Soluna.
And for Tish Montiero and Duke De La Rosa, I'd like you to weigh in on this. Maybe Duke, from your perspective, what does coaching mean to a young person who's struggling, as opposed to having to wait, say, for example, a long time for a therapy appointment, to be able to have, and their numbers show here, the statistics, very ready access in terms of time to be able to talk to a coach? What does that mean to a young person that really is either in crisis or really needs to talk to somebody? And maybe Tish Montiero, just about California's workforce shortage and how it is this represents an effort at innovation around how to deliver mental health services, and we don't have enough of the, quote, traditional workforce that to meet the need. Go ahead, both of you, quickly, if you would, please.
Yeah, absolutely. Good afternoon, everyone. I think for me personally, when I think of coaching, especially as my experience as a student, right, I think it feels a lot more casual and approachable than traditional therapy, right? I think there's no pressure to commit to multiple sessions. You can really just drop in and out based on your own schedule and what you need in that moment. And I think I speak for my generation as well, that low pressure aspect is what makes it super appealing. I think it's sometimes, when we do these sessions, it feels more so like a conversation than rather something clinical or formal. So it makes it a lot easier to open up, especially if you're just starting to explore what you're feeling. For me personally as well, from what I've seen on campus, right, I've tried to schedule appointments through CAPS. CAPS is UC Berkeley's, it stands for the Counseling and Psychological Services on campus. It can sometimes be really difficult to try and schedule a meeting, right? There aren't a lot of available slots. Sometimes it's hard to find a slot that aligns with my personal and academic schedule. Sometimes there are additional costs on top of the already expensive health insurance and tuition that we're already paying for, right? And because of that, having Soluna, it's a lot more flexible, a lot more accessible, and that really makes a huge difference for students on campus, right? So I think for me, coaching to me really fills that gap, and being able to support students without being overwhelming or overbearing.
Thank you. Tisha, the broader policy issue that the Newsom administration, the state, is looking at in terms of the workforce shortage, how does this fill that gap?
Great question. The coaching services available through BrightLife Kids and Soluna fills the gap by expanding our existing behavioral health workforce. And for folks that know, California has been impacted by a shortage of behavioral health providers to provide timely and accessible services in a way that individuals need in the community setting that they need. So for Soluna and BrightLife Kids to provide real-time coaching services that are delivered in a way that is timely with, and you can see in the impact report with 0 to no wait times, it really does meet what our administration has set out to do, which is expand our existing behavioral health workforce to provide coaching services in a way that's preventative and supports the needs of our children, youth, and young adults across California, that's readily accessible, that's timely, and it's provided in a way that they have requested it for, and that's at the timing of when they are maybe at home in the evening hours. So it really has addressed the needs what the administrative set out to do in 2022 by establishing the Children and Youth Behavioral Health Initiative.
Thank you so much. Let me move on here. The numbers are impressive. I think the number is 500,000 people have accessed BrightLife and or Soluna services. And I think it is important, and we know that one of the problems with the traditional mental health system is that there are significant barriers to access. Some of them workforce related, some of them what I would call culture/stigma barriers around some communities not either knowing how or there being some shame around seeking help and services. So I wonder for Noah and Tully, if you might break down that $500,000 number, 500,000 person number, and talk about who is being served through BrightLife and Soluna that previously was not being served at all. If you can just, in general, 5 minutes, tell us who's being served, who traditionally have not had access to mental health services.
Yeah, absolutely. I think this is one of the aspects of both BrightLife Kids and Soluna that we should celebrate the most, is how intentionally designed it was to remove those barriers to access. So we do not ask for immigration information. We don't ask for insurance information. Thanks to funding by the state, we are free. And we also don't require referrals from specific providers, right? So when we're talking about that traditional system, we're doing as much as possible to make sure that folks that have been historically excluded from access can have that access. And I think the data really demonstrates the impact of removing those barriers. So when, families are telling us, 77% of them are saying, this is the first time I'm accessing behavioral health support, I think that number is staggering, 77%. 65% are from lower socioeconomic areas, and 73% are identifying as BIPOC. And so again, I think those statistics speak for themselves, but we shouldn't just focus on that diversity and breadth of access. I think we also need to talk about the speed of access, right? When we're comparing to sort of traditional behavioral health structures. So folks are getting care in an average of 1.4 business days in comparison to months-long waiting lists where they're not getting feedback and they don't know what's going on. So we are really transforming, right, the landscape of behavioral healthcare by being a part of the ecosystem, by supporting other providers, offsetting wait lists, saying, hey, while someone is waiting for specialty care, they can get support in learning these practical skills on navigating, maybe someone just got a diagnosis in the family, maybe they're dealing with medication management, they can still benefit from coaching, alongside that care. So just excited to see how that continues to expand.
Dr. Tully, thank you, just from the teen world, who's being served who previously were not being helped at all by the pre-existing system?
Yeah, thank you. And I couldn't agree more, Noah, with you, what you're saying around these. We really should be celebrating these numbers and what these programs have achieved in what is a relatively short time when it comes to talking about setting up an entirely new element of a statewide continuum of care, because that's what this is, right? This is a sort of population-wide public health style prevention and early intervention program, which I know is super close to your heart, Darrell, and something that you've been working on as part of your career. And that's what these numbers are speaking to. That's the story, right? That the administration and DHCS had this vision of enhancing and extending access to care using digital tools. It's a 21st century tool. Young people are going online. That's where they are. How do we use them effectively, safely, to expand access to care and extend and enhance that continuum of care at a population level, at a statewide level? I mean, California is the size of a country. And in 2 years and a bit of change, we've served over 500,000 people in the state. That's incredible. From Soluna's perspective, we have very similar stats to what Noah shared around who is accessing. 57% are from under-resourced areas, 48% identify as Latino, Hispanic, 52% identify as a member of a Black, Indigenous, or other community of color. These are historically communities that have faced systemic access barriers to care. So we're seeing this digital front door open access, and 50% of our Soluna users who answer our consumer surveys tell us that if Soluna didn't exist, they wouldn't have access to anything because of other barriers: rural community, no insurance, fear, stigma, lack of financial or transportation resources. And similarly, 50% report, well, it's 49% report that this is their first experience for mental health. So this isn't just about expanding access. This is about changing who has access to care, when they have access to care, and how quickly. So my final point is about this wait time, this speed of access. I'm very proud to say that our service delivery team maintained an average of drop-in wait time in our drop-in queue for a coach of 4 minutes in 2025, which is really impressive. It's 9 o'clock at night. You're a high school student prepping for that final exam, and you're freaking out and your emotions are escalating. You open up Soluna, you drop into the queue, and you're talking to someone who's walking you through it and helping you regulate in just a few minutes. That is an incredible resource.
That's incredible, 4 minutes, really. I mean, it's kind of unheard of. Next year, we'll get it down to 3 minutes.
Challenge accepted.
Challenge accepted. Okay, so I want to move on here to Dr. Tyne and Duke. Talk about, I want to hear from both of you, of course, but Duke especially, for a young person living in the age of technology. Why is this easier? Is this inviting? You've looked at the platforms, you've looked at what it takes to access. Tell us from a practical perspective how this creates easier access for people who need to talk to somebody right away, besides the obvious that you can talk to a live person within 4 minutes.
Yeah, no, absolutely. I think that first, that statistic is very impressive that you're able to connect to on-demand help in, on average, 4 minutes. I think, when support is immediately accessible and available like that without these usual barriers, right? Again, kind of echoing what I was saying a little bit earlier, it feels a lot more approachable from my perspective, right? It really creates this low pressure, doesn't feel clinical or intimidating service to utilize. It's not like having just a conversation. It's more like having a conversation, which makes it a lot easier to engage, even if you're not totally sure what you need, right? I think speaking from first my own experience, right? I've used Soluna for things like stress from school, familiar relationships, figuring out my identity. And it was especially helpful as a starting point when I didn't feel personally ready to jump straight into formal therapy, right? And I think that sometimes you just need somewhere to begin, and that's what it felt like. And because of that, for me personally, I walked away feeling less alone and more in control of what I was dealing with. I think it helped me get to a place where I could actually take a next step too, whether if it was using self-help tools or deciding to seek out more structured support, right? And I think, again, I speak for students on campus too. As I mentioned, at places like UC Berkeley, where traditional services like CAPS can be super hard to access. There are extra costs on top of already expensive health insurance and tuition. And when you're balancing tuition, books, and the cost of living, that adds up super quickly, right? So I think the biggest barriers that a lot of students are facing that prevents them from seeking out mental health support are things like wait lists, things like costs, and things like just finding something that works on their own schedule, especially as a college student when you're juggling so many different things at once. Having something that meets you where you are and when you need it truly makes that big difference.
Thank you. Doctor, briefly, if you don't mind. Thank you.
Sure, I'll be quick. So you focused on Soluna, I'll focus on the experience we've had with BrightLife Kids. And I think the most important thing to say is not everybody needs the highest tier of everything. And one of the things we try to do in healthcare is have the generalists do what we can do, but if the asthma gets too complicated, we refer to a specialist. I think one of the things that coaching can help do is address those hidden things that we didn't even know existed. So temper tantrums in a 3-year-old, those are completely normal if you talk to a pediatrician. I'm not going to send you to a specialist, but guess what? That's probably like the biggest problem that the family is having, right? Or ADHD, when you're trying to diagnose it, trying to navigate all the things you need to do at home, in the learning environment, et cetera. Those things are really, really important. And what we see is that the coaching that you can get closes those gaps. And whether it almost helps you sort whether you can go back to your pediatric care or you need to go up, because some people may need, as was discussed, some people do need a higher level of evaluation. But I trained in the time where a long time ago, not that long ago, but long enough ago to think that anytime anyone had a behavioral health problem, I needed to send them to a specialist. What's happening for me in the new era is that I'm learning more by being around people like coaches, community health workers, mental health clinicians that are embedded in my world. And I am getting better at reserving that highest level mental health service for the people who really need it. And I'm not saying that what's going on with coaches is not high level. It's a different level that we haven't acknowledged before. And I think the key that we're seeing now is that children are getting better by having this integration across mental health, behavioral health, and in my case, medical health services, and through the coaching that, again, brings the wheel all together. And the parents become better equipped to navigate what's happening for them, whether they end up going to a higher level of care or stabilizing in the situation that they're in and continuing to be part of like my regular primary care practice. So I think everybody's getting a better path forward, and we're sorting in a way that's most efficiently using the resources we have and capitalizing on the technology that gives patients who didn't have access. I take care of a ton of patients that live in the Antelope Valley where there are zero, I'm in LA, sorry, where there are almost no mental health services. I shouldn't say that. There are very limited per capita health services. And the fact that we have systems like this and others that offer remote connections to the services people need is absolutely transforming the way that community feels like it can navigate toward health.
So we have about 10 minutes left to stay on time. So I'm going to combine sort of two categories. We'll call this a little bit of the lightning round, even though it's rich, it's very important. One is around safety and privacy. How do you assure that somebody who accesses Soluna and BrightLife Kids that their individual or family privacy is protected? How do you deal with safety? For example, the renowned stories of the AI chat boxes giving advice or not responding when a teenager, for example, threatens or indicates that they might be suicidal. How do you deal with all of that? And then finally, what outcomes are you measuring? And maybe more importantly to this, because there'd be some critics out there about, well, coach, what is this accomplishing, right? What is fair to measure? In other words, you can't always measure the avoidance of a negative outcome if somebody gets the help that they want and need and then continues along without a crisis, that's hard to measure. So I want to hear what you have to say about outcomes and measurement, what you've accomplished so far, but what is fair to measure around the success of creating this greater access in a different way that both of you are doing. So first of all, safety, privacy, and then outcomes. Lightning round, 2 minutes apiece. Go ahead.
I'm happy to jump in. Happy to jump in on the safety piece and privacy piece, and I appreciate this question. So a lot of this information is really accessible both in the impact report and on each of the platforms' websites. So really encourage you to check it out, because the key point here is that clinical governance and safety is at the center of these platforms. And we have worked very hard to make sure that that is a top priority. We are serving vulnerable youth in vulnerable scenarios in an online space. Safety, privacy, credibility, and clinical oversight are paramount, especially now when we're having this conversation, a very important conversation around how do we keep young people safe online. And I just want to acknowledge that we do have a question in the Q&A from an attendee who's asking about what does it mean to be providing services on screens at the same time as us having this conversation about the safety of screens. And I think there's two things that I think are really important here that speak to how we are building spaces that are safe, building spaces that are confidential, and building spaces that are credible. Young people are going online to ask about information and find community. Soluna has been designed to take the good stuff about the internet, information and community, and exclude all of the bad stuff, misinformation, disinformation, and unsafe or unsavory interactions. We have strong clinical rigor and governance. Our licensed clinical teams supervise and have oversight on all of our interactions and provide safeguarding support when there is a risk management scenario. We pre-moderate all of the content that service users put on the platform to make sure that nothing goes live and nothing is viewable by anybody else until it's gone through our moderating space. And we have very clear risk escalation pathways for higher acuity needs, both in terms of risk management and in terms of care navigation. To Dr. Tyne's point, not everybody needs a high level of care, but when they do, we have to make sure that they get there and they don't get lost in the cracks. So we see Soluna as being designed as a safe place to land and the connective tissue to make sure you land at your next safe place.
Okay. No, I think that's great on the safety. Talk about outcomes and what you're measuring and what is fair to measure and what really can't be measured in terms of what these programs and this access is avoiding.
Yeah, absolutely. Thanks, Darrell. So Autumn, mentioned a few statistics in the beginning. So I want to restate that 93% of parents and caregivers are reporting that they're seeing a visible improvement in their child's behavioral health care. So they are self-reporting those improvements. But when we're considering outcomes, even though this is what we like to call a subclinical program, we are using clinically validated tools to determine outcomes. So those 89% of families that are demonstrating improvement in at least one behavioral health aspect, that comes from the PSC-17, right? The pediatric symptom checklist. So these are outcomes that we are tracking again with clinically validated tools. Also the caregiver strain questionnaire, that's another validated tool. So we saw the 83% of improvement there. And I think that's really critical because we know that when a kid is having a tantrum, it directly affects the parent or caregiver, and that actually has a population level impact. So I've been one of those parents that's been on a live meeting and gotten a call, right, about my kid at school. And so, we've also seen through the impact report that 33% of BrightLife Kids parents are missing less work. So we're now impacting, right, the California workforce. workforce, which I think is something that we should have continued conversations about. And since we're talking about outcomes, I know we're super short on time, but if you'll allow me 10 seconds, when I think about impact, it's also the stories that we're hearing every day out in the field. We had a mom just come to us at the California PTA conference and say, my daughter refused therapy. She could not participate in it. It was way too intense. And we reached out to coaching and she is doing much better. And this program has been a lifeline. And so I think, again, we should think about the stories that we hear every day in addition to these clinically validated assessments.
Very good. Thank you so much. Anything that anybody else wants to add on those last two questions? Okay. We're right
I
at...
would love to. I'm going to jump in. So sorry, Darrell. I wanted to just
Yes.
add in to this great point that Noah is making around clinically validated tools and measuring real world outcomes. We are so proud to have seen the independent evaluation outcomes research come out of Northwestern University on Soluna, hot off the press, very exciting. And the sort of key take home here is that, young people are reporting reductions in psychological distress at 1 month after using Soluna, and those reductions, which are statistically significant and clinically meaningful, are sustained at 3 months out. So you're seeing these sustained changes that are being held over time that are meaningful. Young people are also saying that they have statistically significant reductions in anxiety, depression, hopelessness, suicidal ideation. These are meaningful reductions that can have meaningful impacts on a person's life. And this data that Northwestern University has released aligns with the data that our Soluna service users are telling us themselves. So 88% of Soluna users that say that they had previously gone to the ER or a crisis center for mental health support are reporting fewer visits to those emergency services after using Soluna. And 46%, that's nearly half of our service users, are saying that Soluna has helped them stay in education, training, or employment. So not only is an independent, traditional academic research setting measuring clinically validated outcomes that are lasting over time, but Soluna users are also telling us this has had a meaningful impact on my life. And that is really encouraging. And honestly, when I saw those data, career highlight for me.
Love that. And I just want to get one other thing on the record, because I think it's so important and resonant in the public discourse about mental health these days. Where an individual, a child and or a family member says something that invokes a safety concern in a coaching session, both BrightLife and Soluna have protocols to report that in an appropriate way to ensure the safety of not only the individuals, but any third parties.
Yes, absolutely.
Yes.
We're all nodding vigorously.
Vigorously,
Yes.
Go ahead,
right.
Noah.
Yes, and our coaches are also mandated reporters. Yes, so yes,
Good.
we do.
Because that's not always true of the artificial approach to
No,
the
I
services,
see.
right? As we have found out. Yeah.
And these are all humans. Like, you're talking to a human. This is not a chatbot, right? And I just think that is a really important component of this, that you're having a real live interaction. You're not doing an AI chat. And I know you didn't suggest that, but just as a reminder, I think
No,
sometimes
I
about
asked the question to clearly distinguish
Mm-hmm.
BrightLife and Soluna from an AI chat, because it's the opposite. All right, last word, Duke. You get the last word, young person. Why is the future BrightLife and Soluna and this approach to making sure that more young people have access to talk to a caring, trained adult?
Yeah, that's a good question. I think the future is, speaking from a student perspective, we have priorities and we have values when it comes to looking at what kind of different mental health services we look at. And I think for me personally, right, it really is privacy and confidentiality as my personal top ones. I know we mentioned in the introduction that we have founded the first ever Soluna chapter, Soluna Club at Berkeley. And one of the recurring things I hear from my peers one of the biggest concerns young people have when it comes to mental health support is safety, is privacy, is confidentiality, right? It's where is my information going and who can see this? From my experience utilizing Soluna, it is not only confidential on paper simply because you don't put your name on anything you post, right? But it also feels confidential too because it's separate from school, it's separate from institutional systems, right? I think that alone makes a big difference because it really encourages you to be more honest. You don't have to feel like you're being monitored or judged, and you can actually open up in a real way, right? So I think that's the future, right? If I have time to just highlight one space that I really like, I really love the community spaces. I think that is very thoughtfully designed within the Soluna app. I love the Reddit-based, I call it the Reddit forum style space in the service in the app because they're moderated. Nothing toxic or triggering is allowed, but you can still connect with people you can still connect with people who are going through similar things without the risks that you usually associate with being online, right? And because everything is anonymous as well, you don't have to worry about your identity being attached to what you share. While also, again, the benefits of being able to read other people's posts or share your own helps you realize that you're not alone. And I think that's something that's really powerful, being able to be heard. And I think that's the future of mental health support for our young people.
Well, thank you all very, very much. Thank you to the panel. It was a great discussion. Sorry if we went a little bit over. I turn it back to, who am I turning it back to? Go ahead.
Thanks so much, Darrell. I'll go ahead and take it from here. Thank you so much, Darrell, and all of our panelists. That was a wonderful conversation. And thank you all for joining us today and for your partnership and support of children, youth, and families. We invite you all to please don't let this be the last that we connect. Please reach out. You can reach out to BrightLife Kids and Soluna directly. We'll go ahead and put a slide up to share with you some contact information so you can reach out to partner. As you heard from Dr. Shannon Tyne, BrightLife Kids and Soluna both partner with community-based organizations, health systems, schools, youth serving organizations, and we would love to partner with you. Please check out the BrightLife Kids and Soluna Impact Report. There are many more testimonials. You can hear directly from real users about their experiences with these programs and services. And please reach out to DHCS. If you have any other questions about these programs that we didn't get to during today's conversation, please contact us at CYBHI at dhcs.dhcs.ca.gov. Thank you again for all of your time, for your partnership, and the work you're doing to support children, youth, and families in California. Take care.
Thank you.